Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about urine analysis. What is urine analysis? Urine analysis is a test to examine urine to find abnormalities which may indicate a disease or infection. Again, urine analysis is not a confirmatory test. You need more tests to rule out a disease or infection. Now, urine analysis is done in three ways. Visual exam, where you look for the color and appearance or clarity. A dipstick method, and third is urine is examined under microscope. The color of the urine. Normal color is straw, yellow or amber, and as the color gets darker, it may indicate dehydration. So the color is affected by hydration, the amount of water intake, sometimes food, medication or disease can affect urine color. The orange color urine, it may indicate excess intake of vitamin, especially A or B, or hyperbilirubinemia in liver disease can cause orangish urine. Rifampin is an antibiotic which can cause reddish orange urine. Brown color urine may indicate severe dehydration or liver or underlying kidney disease, or sometimes rhabdomyolysis. Rhabdomyolysis, there is severe muscle trauma, release of myoglobin leading to brownish urine output. Now, certain medication can cause brown urine output. These include metronidazole flagyl, nitrofurantoin. It's an antibiotic to treat UTI. Senna, which is a stool softener, can cause brownish tinge urine. Red urine. Red urine may indicate bleeding, or sometimes food, beets, rhubarb, can cause reddish urine. Certain medication, example rifampin antibiotic, again can cause reddish orange urine. Phenazopyridine, it's a urinary analgesic. It can cause reddish urine. Green color urine. Green color urine may indicate presence of bacteria, or sometimes IV dye used in the hospital, methylene blue, can cause bluish greenish urine. Certain medication, example propofol, indomethacin, can cause greenish tinge urine. Now, next is appearance or clarity. Normally, the urine is clear and transparent. Abnormal findings are slightly cloudy or hazy, cloudy, and turbid. Turbid means you cannot see through the urine. Now, through the dipstick method, you are ruling out specific gravity. What is specific gravity? It is the concentration of substance in the fluid or in the liquid. So if there is more substance, specific gravity increases, and if there is less substance in the fluid, specific gravity decreases. It is also called osmolality. Normal specific gravity of urine is 1.003 to 1.030. If it is greater than 1.03, that means there are more particles or less fluid. It's concentrated urine. So it may indicate dehydration, less fluid, or glycosuria. That means it is seen in diabetes mellitus. If there is high blood sugar, urine may contain glucose. The glucose are not reabsorbed by the kidneys and get excreted through the urine. So that can increase the specific gravity. If the specific gravity is less than normal, is less than 1.003, that means overhydration. That means more fluid, more water in the urine, or diabetes insipidus. It is a condition where there is no antidiuretic hormone. As a result, more water is excreted, or water is not reabsorbed back into the body. That is called diabetes insipidus. Now, the pH. The normal pH is 4.5 to 8. pH is the concentration of the hydrogen ion, and pH indicate whether the substance is acidic or alkaline. pH 7 is neutral, less than 7 is acidic, greater than 7 is alkaline. Now, certain diet can affect urinary pH. Example, protein-rich diet or diet more of meat content. This meat or protein has amino acid. When it is metabolized into amino acids. It breaks down into ammonia and then into urea and finally get excreted through the urine. So that can cause acidic urine. But if the diet is vegetarian, more fruits and vegetables, it can cause alkaline urine. Certain drugs, example sodium bicarbonate or Diamox, these all are alkaline in nature, so these drugs can cause alkaline urine. Infections, the bacteria present can split the urea and as a result, the urine becomes alkaline in nature. Poor kidney function. So the body's pH is maintained by lungs and kidneys. So if there is an underlying kidney disorder or poor kidney function, it can affect the body's pH as well as urinary pH. Next is glucose. Normally the urine glucose is negative. The glucose are filtered by the kidneys but reabsorbed back into the blood. So if present, it indicates diabetes mellitus. That means high blood sugar. As a result, sugar is not reabsorbed back into the body and sugar is excreted through the urine. So rule out for diabetes. If diabetes is not present, rule out for low renal threshold. That means kidney cannot reabsorb the glucose and more glucose is filtered by the kidneys. Another cause is pituitary disorder. So rule out for any pituitary condition. Next is ketone. Normally urine ketones are negative. If present, rule out for type 1 diabetes mellitus. In type 1 diabetes mellitus, there is no insulin. As a result, blood cells cannot convert blood glucose for energy. As a result, body uses fat for energy production, and whenever fat are metabolized, ketones are produced as a byproduct and get excreted through the urine. So if ketones are present, first rule out for diabetes mellitus or DKA, diabetic ketoacidosis. Another cause is prolonged starvation. Starving for long time, no carbohydrate intake. As a result, again, fat are used for metabolization of energy. As a result, ketones are produced as a byproduct. Another cause can be strict ketogenic diet. Now blood. Normally the blood is negative, but if present, it may pick up hemoglobin, myoglobin and erythrocyte. So hemoglobin carries oxygen in the blood, myoglobin carries oxygen in the muscles, and erythrocytes are RBCs. Normally erythrocytes are not filtered because they are big in size. So if blood is present, rule out for muscle injury. So if there is severe exercise, that can be transient, but if it is a muscle injury, what happens is myoglobin get released, goes to the kidneys and get filtered. Or rule out for underlying any kidney disorders, stones, bleeding disorder or cancer. Even though the initial stage blood may not be present, but in late stages blood may be present in urine. Next is proteins. Normally the proteins are negative in urine. If present, there can be short-term causes or long-term causes. Long-term, rule out for kidney disease. If short-term, it can secondary to heart failure, increase oncotic pressure, fever or stress or exercise. Now nitrites. Nitrites are absent in the urine. If present, rule out, send the urine for culture. The reason is the bacteria converts nitrates. Nitrates are present in urine, but the presence of certain bacteria converts nitrates to nitrites. So if nitrites are present, send the urine for culture and rule out for infection. Leukocytes. Leukocytes esterase are negative in urine. If present, you have to rule out for infection. Again, send the urine sample for culture or rule out for any inflammation in the urinary systems. Bilirubin or urobilirubin. Normally it's negative. If present, rule out for any liver or biliary dysfunction. Under microscopy, you are ruling for WBCs. Normally it is 0 to 4. If it is higher, rule out for infection. Again, send the urine for culture. RBCs. Normally it's not filtered. It can be 0 to 3 to 5. If present, rule out for kidney disorders, cancer or blood disorders. CAST. CAST are tube-shaped protein. Normally it is 0 to 4. If more than normal, rule out for any kidney disorders. Bacteria, yeast or parasites normally absent. If present, send the urine for culture and rule out for infection. Crystals. Presence of crystals in the urine may indicate a kidney stones. So today we learned about urine analysis, and thanks for watching my video.